we are at the last section. This may not go the whole time. It might be a little bit shorter, which is fine. But now we've basically gone through what is Parkinson's, what's our method, how do we use it, why Pilates. We went through auxiliary training modes. We talked about scoliosis and spinal asymmetry, which is inherent in Parkinson's disease. We talked about some basic neuroscience and techniques to add behind the physical exercise training. We talked about all the different forms that you can use and how to use them. You're more than welcome to use those forms or to make your own forms or change out the names on mine, whatever you like. And then now that brings us here to section 8, which is putting it all together. So we have information here which kind of helps you kind of put the programming sessions together, session format tips, some notes about queuing. And then here, I'm going to show you 5 more standardized forms because maybe you have so much information in your head, you're like, I just don't even know where to begin. Like, I know what I need to do, but where do I even start, or how do I organize the information? So these last forms will help you, and they go by the stage. So in stage 1, you could use this forms, and it basically includes everything we've talked about and shows you how to kind of put it into kind of like a little formula. Okay, and then some best practices to include when creating an exercise format, and some red flags, mostly red flags is what we want to look for. All right. So, really quick, do you have any questions from the last session that we had, which was about the forms? Have you had a chance to try or use any of those forms yet?
Not yet.
Okay, that's okay. But I will say that when you take on your first client for your final project, you will
Mhm.
need to use the forms because I
Okay.
want to see that you can gather up that information, correctly.
Mhm.
All right, so key points in starting. So we're going to use the Pilates method, and mostly it's the Pilates principles to create the outline for the exercise session format. So based on the assessments, the global posture observation, the disease stage of your client, what the P4P stage recommendations are, which are like if that client's in stage 1 of honing YAR, that means they're going to be in stage 1 of the P4P, which is it's called the big push, right? So you want to correlate the stage of PD with the Pilates for Parkinson's stage of exercise, or the protocol that we use. And then, all the information gathered, and let's see, include exercise movements. I don't want to go through and just read this whole thing, but essentially anything you give to that client is going to be guided by the Pilates principles. So it doesn't matter if you give them a lunge, you give them a push-up, or you give them the bent knee series, which is an actual mat Pilates exercise. Everything you give them is going to be guided by the Pilates principles, which is breathing, axial elongation. These are some of the general principles: organization of head, neck, and shoulders, spine articulation, alignment, and movement integration. So you can go back to chapter 3 or section 3 to see a whole list of those. And then you're always going to need, on the very first session, to decide which spinal movement is going to be most relevant for the client right now. So example is, today I saw 2 clients, and these are clients that I see regularly. But each time you see them, you have to kind of take a look and decide where the focus is going to be. You can't necessarily write the whole class out of what you're going to do and then the client comes. You have to be able to program on the fly based on what you're looking at and what you're hearing, what you're observing, right? So with one client, what I noticed is that he really needed some extension work today. And with the other client, he really needed more lateral flexion and opening followed by extension. So those two kind of together is where we stayed within our 50-minute session. And then the other thing that's really important is you need to be able to teach the client how to position themselves so they can replicate the exercise. Because remember, it's only going to be as good as what the client can repeat at home by themselves or with their caregiver, whoever's helping them. So you have to teach them how to do the exercise, and that includes setting them up. So if they have to go to the floor, let's take an example of maybe they're going to do the supine bent knee series, which is mini set number 6, and they have to go on the floor and lie on their back. Well, you have to teach them the steps. Step 1, go to the floor, and then you watch how they go to the floor, and maybe you'll give them 1 or 2 tips on how to get to the floor carefully, safely, and more easily, right? So that's step 1. Step 2, they're going to lay down and they need to put their hips, their knees, and their feet in 2 parallel lines. So they got to get themselves into position. So do you follow what I'm saying? You got to give them the steps to get into the position to do the exercise, not just the exercise itself. All right. And then when we get into session format tips, essentially, when you create your session formats, they are going to be based on these things right here, the personality of the client. So sometimes you're going to get a client who is really like, yesterday I had a client, and this client was a nurse. She was like a specialization wound care nurse, or so when she says she's a nurse, now I know that I can speak to her more with anatomical and medical terms, right? So that's her personality. But I also have another client who was a forest ranger. So me talking in medical and anatomical terms is not going to fly for this client, but he still needs to do the exercises. So I will probably use a lot of analogies like, well, you know how tall and erect a pine tree is? Think about that when you're standing in this position. Or I may say something, so imagine the smells in the forest, or I'll ask him questions like today we did the Pakwa series, and that client, he had to name trees for every single one. Today I had another client, he was on the TRX, he did 4 sets. They were all squats. The first set was center squats. The second was to the left, to the left, to the left. The third set was to the right, to the right, to the right. And the fourth set was alternating left and right. As he did each set, he had to pick one philosopher and explain to me, teach me the premise of the philosophy of that particular philosopher. And he did great. So this is all a neurocognitive approach, especially of recall. And he recalled dates and, names and philosophical terms and all this stuff. So, that goes with the personality of that client. The stage of the client, you have to determine how the exercises are going to be set up based on the stage of the client and the needs of the client. So the stage of the client, if I'm working with a mid stage, I already know there's a chair very close by and we're close to a wall or a table or a counter or somewhere where that client can easily sit down or offload weight for support and stability. The needs of the client. Let's say the client really needs extension, but the client is in mid stage. So they're very imbalanced, right? They have difficulty, postural instability. Well, in this case, not only am I going to have the client close to a chair or a wall, but I'm going to be doing all my extension exercises with the chair or with the wall or with something that the client can have their hands on or be close to and be able to do extension, even if they're standing up against a wall and they're just doing this kind of extension where their thumbs come to the back of the wall and the back of the head touches the wall, that's still extension, right? As where if I had a stage 1 who doesn't have postural instability, they're going to be doing maybe baby swan on the floor because they need extension, but I want to strengthen their extensors. Or maybe they're going to be doing the Pilates 100 from the prone position. Do you see what I'm saying? So stage and the needs of the client. Okay, equipment, props, and training environment available. This one is when you're in someone's home, or even if you're in the studio, what do you have to work with, right? So when you're in the studio, it's easier because there's lots of props, right? And the training environment might be easier because you have the Cadillac, you might have floor space, you have yoga mats, you know, etc. However, when you do private visits and you go into someone's home, you have to have the ability, and this is more taught in the master trainer program, how to scan, what to look for, how to improvise quickly, what props, what things can be props quickly. For example, a yoga block is easily accessible in a Pilates studio. And that's what I use a lot to establish posture, right? So the feet are parallel. I put the yoga block so that the feet are aligned with the ischiums as best as possible. But in someone's home, this person yesterday, she didn't have a yoga block, but she had various sizes of books all over. So I quickly scan and I find the book that is the size of a yoga block, right? So it's things like that, being able to quickly substitute things in for props when you're in an environment that's unique and different. And if you go to people's houses, it's constantly going to be unique and different. Strive to include the absolute elements in all exercise sessions. So the absolute elements, these are things that you're going to hit in every single session that you do with your client. Components of physical activity. You're going to make sure that you're working coordination, flexibility, balance, stability, mobility, and in some way, strength, right? You're going to hit all these things. You're going to make sure that you're training them in all planes of motion, and you're going to make sure that you're hitting all the directions of the spine with an emphasis on the spinal direction that the client needs the most. We are always, yes or yes, going to have balancing exercises to support upright posture and flexibility exercises, some kind of stretchy thing, right? So the balancing exercises, I will just say that when you think in terms of what we do and why we do it, how we do it, we're essentially trying to hack into the nervous system. We're trying to hack the fascia to get better movement. And we're trying to get in and increase the function of the cerebellum, the cerebellar function, the base of the base of the brain, the primitive brain, right? Anytime that you do any kind of balancing exercise, whether they're standing on one foot or they're standing with their feet heel to toe and they're opening and closing their arms, anything that involves balancing, weight shifting, those are the things that are going to trigger cerebellar function. And just as a quick and easy note, the cerebellum is responsible for ABC. A, which is, oh God, I just said it this morning and now I'm blanking out. Not neural sharpening. What is that? A. Sorry, I'm blanking out. I've been doing this all day. I'll come back to the A, but it's neural sharpening and it relates to an A. B, balance. C, coordination. When the A comes back to me, I'll tell you what it is. But anyhow, neural sharpening, balance, and coordination. So those are going to be the things that are going to happen from the cerebellum. right? So any kind of balancing, you want to put in all kinds of balancing things. It doesn't have to be that the person has to stand on one foot necessarily, but if they can shift their weight and maybe lightly pick up a foot or even just put their toes on the floor, maybe they're starting with their hands on two stabilizing points, counters or chairs or whatever, and they let go for a moment, 2, 3, 4, and then put it down, put their hands back down. That counts. Okay. How to cue exercises in the P4P method. Support the development of proprioception and proprioceptive refinement through thoughtful cueing. All right, so we teach, we cue, and we do. So when you're teaching, you want to tell them what's coming down the pipeline. So generally, I announce the exercise. I'll say, let's do extension. And then I'll say, baby swan. Let's do extension. How about baby swan, right? And then I put a simple explanation with a note of why. So this doesn't have to get complicated. This can be extension. Let's do baby swan. Let's work on your posture, right? Because baby swan directly relates to strengthening the spinal extensors so you have better posture. And that would be the category, right? Posture. We have the 3 categories we're always referring back to: upright posture, spinal mobility, and preserving ambulation and gait. And then I have notes here of using visual enhancement of touch to stimulate the neural pathways, or use touch patterns from NLP. So these are the cues where you touch, or maybe you'll click, or you'll place, make a noise. Anytime you make any kind of click, snap, I'm not good at snapping, a clap, anything like that, they're dopamine signals to wake people up. They're dopamine receptor signals to wake a person up, so they get more alert, right? It's just a kind of a dopamine neurotransmitter thing where it wakes them up a little bit more. So you can use those kinds of little sound signals. And then we cue. So when we're doing the cueing, it's better if you know what kind of learner your client is. So are they more of a visual learner, a kinesthetic learner, like touch is really good for them, or an audio learner? So that way, when you give your cues, you can use more appropriate cueing that's targeted to them. So this is a little example on cueing for lateral flexion of the spine. Gently bend sideways like a willow tree in the wind. That would be the visual. Verbal, listen for the sound of your exhale as you bend sideways. The deeper the exhale, the deeper the bend. Tactile, you can tactile with your hands, shaping the movement. We talked about that a little bit, Taylor, shaping the movement. Yeah. And do. So if the client's still having trouble doing the exercise, then you can show the client how to do what you're asking for by you being the mirror. So now you're using the mirror neuron approach. So it's the look at me, and I usually start with my hands, right? Because then pick up one hand, they can pick up their hand, the other hand, and then, I'll start to bend, and then they'll follow me. They'll do exactly what you're gonna, what you show them. So that's kind of some notes on a cueing progression: teach, cue, and do. So teaching is more like telling them what to do. Cueing is how to do, and doing is doing it. Is that clear?
Yeah.
Cueing tips. All right. So on the cueing tips, it depends on their stage of their condition, how you're going to cue. So when you're cueing somebody in early stage, you can basically just give the cues like you're cueing a regular class or a regular private client. But as the stages start to progress, your cueing has to get shorter and simpler, short, sweet, and to the point. You can't talk to them. because it's going to be too much information. It's too overwhelming. So tactile cueing is super helpful, but also take note that because of sensory perception changes, sudden and any kind of tactile cue, even if you just put your hand like that, you might get a flinch, right? Because their neurosensory system is really amplified, right? So don't be surprised if you touch and they make some sort of startling movement. You can move slowly, and usually if you hold your hand up first and you cue not lightly but firmly, it's better for them, right? And also if you want to ask for permission, generally I ask for a blanket permission in the beginning, and I will and then I'll just go ahead and cue them throughout. But I will check in. Are you okay? Am I pushing too hard? Do you feel where my hand is? So those kinds of things. Reminding the client how important gaze is. You will probably have to cue gaze through the entire session, not once or twice, but you need to make sure that the eyes stay up and the eyes stay open. So with the eyes, we already talked about this earlier, how the vestibular ocular system, so the vestibular system, which is balance, right? The inner ear canal with the eyes, they help the client, they help people in general to establish stability, right? But there's also cervico-ocular reflexes at work. So this is why the neck exercises are so important, because they help the client also with stability and balance. And eye reflexive exercises help with saccades and tracking. So example, today, to help the client establish better gaze, we did the head and neck movements, the pakwa ones. We did them the first time where the eyes can travel with the head and neck. Then we did it a second time. I stood the client at a table, both hands stay on the table, push into the table so you can stay upright. And then I stood in front of him, and there was a ledge that had a little colored vase on it. And I would cue his eyes, his gaze, to stay fixed on that point while he moved his head. So his eyes stay fixed on the point. And yes, and to get him to, because you'll see that the eyes will want to go away from the fixed point. But I would also tap on the shelf, eyes here, gaze here. And so there's the combination of that dopamine receptor alert, right? And a gaze cue together to keep his eyes on the target. Also, you want the gaze to stay forward and up, because the tendency will be for the gaze to drop down. When the gaze starts to drop down, it will facilitate forward flexion, okay? Another thing you want to keep in mind is that the gaze, if it stays up, especially when you want them to stand up, it's going to be easier because the brain understands that we want to go this way, and the movement and the actions are going this way, versus the movement and the actions going this way, but the eyes telling the brain down. So we need to get those two things correlated and in conjunction. So when they're going to stand up from a chair, let's say we're doing sit to stand, the tendency will be that they'll want to sit to stand quickly, right? Up and down and up and down. So what I will say, I'll put my hand and I'll say, okay, hold on here. Big inhale through the nose, eyes up, exhale, and that's where the stand happens, on the exhale and the eyes up, okay? And you will notice that they have better, more strength, more oomph, if I could say that, so more kind of momentum to help themselves get up, right? Keep the cueing simple, 1 or 2 directions at a time. Use your NLP programming technique to cue what, how. So I use this a lot in general classes, but you can use it with your clients. We're going to the floor, go down to the floor slowly. Okay, so what, going to the floor, going to the floor slowly, going to the floor safely. So what, how? Delivering cueing which appeals to visual, auditory, or kinesthetic appeal. So the easy way, if you're not sure what kind of learner your client is, listen when they're talking to you or you ask them questions and they answer the questions, listen to the types of words they use. They will tip you off as to what kind of learner they are. So if you ask them a question, how are you doing today? I don't know, I feel tired. Or I don't know, I always hear that sounds of, I don't know, whatever they say, or they may use a visual. I feel like, or I always see haziness, or I get dizzy a lot and it feels like my brain's spinning, or I see stars, or I see colors, or whatever it is. You just want to listen to how they explain things to you. And those are cues into how you will talk to them. And if you really are just not sure and you're starting with a client for the first time, then it's good to give your cues in each one of those categories. So maybe you'll give one cue as a visual cue, you'll give an auditory cue, and then you can do a kinesthetic cue, a tactile cue, or say it feels like. And then having patience. So I know this might be a no-brainer, having patience, but I'll tell you something. It really does take a lot of patience, and always everything they do, there's a saying, you might know this one, Paulina, but you are tirando rosas. You're just throwing roses all the time because it makes them happy. It makes them feel like you're not the person going, come on, hurry up, get your, they get enough of that. Trust me. The caregiver alone is frustrated too, and it's really hard for the caregiver as well. So you having patience while they get up and down from the floor, which could easily be a 3 to 5 minute process, you can start saying, oh, I love the way you're taking care of putting your whole foot flat. Let's see what you can use to help you. How about this chair? You're facilitating, you're helping them. Don't forget to breathe. Eyes are up because we want to go up. So you can turn the whole process of whatever they're doing into a learning experience for them and a patience developing experience for you. Okay. And then also remember that it takes them a much longer time because they have to process the information, and the neural output from the brain out to doing whatever they got to do is taking longer. Okay. And then also sometimes they need to see an example to understand. So today I had a client who I was trying to get him to do lateral flexion over a giant stability ball from the kneeling position. So I tried it once, setting him up into position. First, I showed him. This is what we're going to do. Lateral flexion. We're going to open the side body, right? Then I tried to set him up into the position, and that was just going awry. Abandon. Take a new approach. Then it was sitting him on a couch and having him flop over the side of the couch on the right, and then scooch over, flop over the side of the couch on the left. So that's how he ended up getting his lateral flexion. But that was like maybe a whole almost 15 minutes for that one exercise, because we had to go through a series of different things to get him into that position. So having a lot of patience and being able to quickly abort and restart in another way to get the movement that you're looking for is really a skill that has to be practiced, and a skill that takes a lot of patience. Do it with them. That again activates the mirror neuron system. The look at me cue automatically activates the mirror neuron system. And if you are going to use that, you really want to be standing directly in front of them. Try not to be standing off to the side. Try to get directly in front of them like you are the mirror. Okay. Always speak in a calm, softer voice. Sometimes a louder voice is stressful, right, for them. Because remember, everything's amplified. So sounds, movements, colors, lights. Lights are very, very, can be overwhelming. Sometimes they want dimly lit areas. So those are things that you have to be conscious of. And think in terms of less is more. Low risk and high demand, moving slower. This one is probably the thing you're going to always use every single time. Just remind yourself, less is more. So let's say I'm going for a full lateral flexion. I want this, and it's turning into a disaster, which is possible, right? I'm going to go less is more, right? Can you sit down on the couch and just tip your ear down like this? Now I've got lateral flexion of the cervical spine. Let's start there, right? So low risk, high demand. I can get, so again, going back to the client who sat on the couch. So you do know how the couch has those two roundy armrest things that sometimes can be really big and bulky? So to get the lateral flexion, he sat all the way against one of those and flopped over the side, right? So that's low risk, high demand. I'm getting lots of lateral flexion because he's really going over the edge there, but he can't hurt himself in any way really because he's sitting. He's got back support from the cushion of the couch, and he's got a nice cushy armrest that he's going over the top of. So low risk, high demand. Okay. Parkinson's is really debilitating. We know that. We know that it diminishes movement and function. So, whenever you're working with someone, I always remind myself, I never lose patience. I really don't, because I always remind myself that Parkinson's can happen to anybody, even, us. It's just something that can happen. And I always think, what if this was somebody I loved? I know it's my client and I do want to give love to my client, but what if this were my grandfather or, a brother, a cousin, a sister, a father, a mother, somebody who's really, you would really want to do everything you could to support them and to help them. Okay. Now we'll get into the standardized forms. Okay. So let's say, you've met with the client, you did the intake form, you've got a lot of information, you know what's going on, they're in mid-stage, they're in stage 2, let's say. They're in stage 2, they've got some scoliosis starting, their primary motor symptom is, let's say, postural instability and gait disorder, right? So you're like, all right, what am I going to start with? Well, these forms kind of help you organize the information. Stage 1, stage 2, stage 3, 4, and stage 5. So let's go to, we'll start with stage 1 and then we'll talk about stage 2 with the client. In the stage 1 form, the left side, you have what I call links. These are the things that generally occur in a workout, right? And for sure in a Pilates workout, these are the things that we go through anyways. Okay. You have a space here to figure out which exercise you want to include in that session. You can write it in if you want. Corrective exercise wise, you don't have to worry so much about doing specifically a corrective exercise, but it could be corrective in the sense of like lateral flexion, maybe you're doing side bend and you're going to do an extra exercise, or you're going to make a little note that needs extra, or give them homework on this, like put an asterisk homework under lateral flexion, right here. It'll say homework. That's going to be a homework thing. All right. And then remember when I talked about earlier, these absolute elements, coordination, flexibility, balance, stability, mobility, and strength. The planes of motion and the movements of the spine, well, here they are. Coordination, flexibility, balance, stability, mobility, and strength. So you can just put a little check mark there. So by the end of your workout, you can see if you've kind of hit all these things at least one, if not more times. Plane. S is sagittal, C is coronal, or you can use an F for frontal. Coronal and frontal are the same. T is transverse. This is really good because sometimes you'll put together a training program and everything is sagittal, which is the most common thing. And we need to make sure that we hit all the planes of motion. And then your comments, right? The links over here cover the directions of the spine. So that's why they're not listed separately. Now, in one session, am I going to do every single one of these exercises? No, but I'm definitely going to do breathing. I'm definitely going to be doing probably extension because they all need extension. So certain ones of these, you're going to be doing, and some may be focus. Like, for example, let's go to 2. If I have a client who's got postural instability and gait disorder, whether they're in stage 1 or stage 2, stage 1, for sure, I'm going to be doing leg work. I'm going to be doing hip work. I'm probably going to be doing some kind of full body integration. If they're in stage 2 for sure, and they've got postural instability and gait disorder, again, leg work. This could be the lunge series, right? Hip work. This could be the sideline bent knee series to strengthen the hip flexors, pelvic, to strengthen the muscles around the pelvis, any of that. And then when you get into stage 2, you want to start incorporating, reinforcing strength in certain movements. These are the 7 primal movements: plank, push, pull, rotate, squat, lunge, and hinge. Now, you don't have to do all of them, but if my client has postural instability and gait disorder, yes, I'm going to do leg work. I'm going to do lunges. So if I'm going to do lunges, then I'll just put a check right here under lunge, right? Or maybe I'll do some squats. Maybe I'll do both. I'll start with squats and I'll progress into lunges. And then when you start getting into those absolute elements for stage 2, you're more concerned now about coordination, flexibility, and balance. So you don't have to, hit all of these, but you for sure, it's good if you do, but you for sure have to hit these 3 in some of the exercises you do. Okay. And then down here, all of the forms have the SOAP notes. SOAP, 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 they all have it, right? Do either one of you take SOAP notes now? Yeah, a little bit?
I
Okay.
do.
So, okay, this doesn't have to be, this can be as detailed or not detailed as you want. However, you do want to make notes to some degree. This is just an easy way for you to keep track of whatever you did with that client and whatever happened. So subjective, when you come in, I always start with, how are you feeling today? Give me the updates. Client says feeling tired. I'll write that down. That's subjective. Objective, client looks tired. Client has bags under the eyes. Client has extra flexed posture today. They're droopy. Okay, assessment. I will put them through the workout. Client struggling with right side lunge. Plan. Strengthen right side glute. Maybe bridges with a right side press up from the right glute, right? Focus on the right side, basically. So that's an easy way to do SOAP notes that are relative to what your workout is in terms of what you just gave the client or what you're going to give the client. Make sense? Yeah. Let's do another one. In stage 3, same links, it's all still the same stuff here, but now we're also taking more into consideration the neurodevelopmental sequence. Why? When we're babies, and I mean, as adults, we've already, as babies, gone through a whole process which got us to being able to walk, right? So those things are already inherent in us. So the head and neck movements, mostly lifting the head into extension, being able to move the head, right? Prone, this is laying on our tummies. Rolling, this is side to side. Reaching and grasping. Tall sit, that's where we're sitting on our glutes or our ischiums. Kneeling or a tall kneel, standing, and then gait, right? So these are the neurodevelopmental sequence steps here, and they're already innately in us. So we just need to recall them, because by the time you get to stage 3, motor learning goes down. It's not the time to teach them new things anymore. You have to rely on what do they already know? What's already innately in them? What are the primal movements? So by the time you get to stage 3, you're still doing maybe primal movements with them, right? But now you're really kind of trying to draw upon what they already know. Makes sense? This also comes into play in mid-stage when you took your intake notes and you remembered that the person said that they used to be a tennis player or they used to be a golfer. Okay, so here comes the golfing stuff. Rotation, rotation. Pretend that you're like, for example, if I ever have any golfers or anybody who's done excessive rotation, I always put this stuff in, this kind of like twisty stuff with arms. Maybe arms start on the counter, twist and go up, twist to the side, twist and go down, and come back up. All right, so that's how you would use a lot of that stuff. Actually, yesterday I had a new client and she has a history of dressage. She was a competitive dressage athlete, which are the horse rider people. They jump over things and all that stuff. So that already told me that we're not doing anything with the adductors, because if anything, they're already too tight, right? She's already used to clenching in. I need her to be able to go out. And sure enough, her femur heads were rotated in, right? So, and that's probably as a result of a lot of that compressing in it to hold yourself on the horse, right? So that kind of gives you an idea for stage 3. She wasn't in stage 3. I'm just saying, like, that's how you can use that type of information. All right, then in stage 4, remember stage 4, it's now difficult to walk. Maybe they can still stand, but they're not really able to get around by themselves at all. Probably they're not living by themselves, So by stage 4, you still have the same links, but now we're looking at these 3 absolute elements: stability, mobility, and balance. So whatever exercises you're going to fill in here, which can be anything, you're going to want to make sure you hit some of these. And the pakwa is here is because by the time you get to stage 4, you're going to be limited in what you can do. And the pakwa Sky series is still stuff they can do, right? The head and neck movements, maybe the arm movements, because they're sitting down. They're not going to be able to do it standing up, right? Yesterday we did the Pakwa series with the client and I broke it into 3 components. They did all the head and neck and they were having a lot of dizzy spells. So we did all the arm stuff seated. And then when they felt a little bit better, we were in the kitchen, one hand on each counter, and they did the stepping series of the Pakwa with balance with their hands. And then, we took it from there. So this is here to remind you that you can use this no matter what, and you can check off a lot of these boxes, right? Stage 5, you're not going to use really. And there's a whole separate workshop that goes with stage 5. This is different because by this time they are chair bound or bed bound. A lot of times by stage 5, they're already in hospice, which isn't necessarily, that doesn't mean they're on their last leg or anything like that. That just means that it may be that they're in hospice because it helps the caregiver also, because once you get into hospice, you're automatically eligible for certain types of extra support. Maybe a nurse comes and brings you medicine or extra napkin things or depends or whatever they need. Maybe you have an extra person who comes and gives you a break, so that person will stay with your Parkinson's person for 2 hours or 3 hours or whatever it is, and you get to go to the market or take a nap or whatever. Do you see what I'm saying? So by stage 5, there's other considerations going on. And when you come in to do exercise and movement, you're more limited in what your options are, but you still can do a lot. So here again, coordination, flexibility, and balance. So in stage 5, there's probably not going to be a lot of balance, but you would strive for it if you can. This would be in the way of just sitting up, hold, 2, 3, release, right? So simple things like that, being able to sit up, or maybe they have arm strength. Maybe they can pull themselves up and hold and then let go. Things you can do in stage 5, you can still do head and neck movements. They can't really do, I did have a stage 5 who was doing sit to stand, but that wasn't for long. And if they don't, the key is you need to keep them here. They can still sit to stand usually in stage 4, but stage 5, this is difficult. Feet and gait. So feet would be more, that'll be changed to foot and ankle movements. Cross reach, having them reach across, right? Or reach up or reach out. Any kind of joint movement that you can get out of them is fabulous. Hip mobility and hip extension. So if they're sitting down or lying down, the only way you're going to get hip mobility, well, I'll start with hip mobility. The only way you're going to get hip mobility is if you are manipulating them, supporting them to manipulating them. So if they're lying down in their bed, you would bend their knee and gently push it over to get that rotation, right? So that could be something for hip mobility. Or you bend their knee and you stir the femur head in the joint gently, and then you reverse that, right? So it's much more manipulation. Hip extension, the best way to get this is to get a big pillow and put it under their sacrum. So this will help open up the hip flexors. And, again, this works really specific and very different, and you won't have to worry about this now or probably for quite some time. If you do get a stage 5 client, then you can contact me right away and I can help you, support you with that. Okay. All right. Best practices to include in creating an exercise format. So we always want the client to take their socks off, because remember, all the neurosensory receptors in the feet have to be activated. We want them to be activated. Training barefoot's going to help stimulate the fascia in the feet. It's going to improve their stability and balance. And it's also going to provide more accurate input into the brain so that the output can be better. You want to begin the session with the warm-up, and generally the warm-up is breathing. So breathing, directions of the spine, head and neck movements, all that stuff can be warm-up. As you progress in your Parkinson's condition, that warm-up will actually become your exercises, right? And the breathing is super important. You've got to have them breathing in through the nose and out through the mouth, because it's very easy for the tongue to start to rest on the bottom of the mouth, and then the mouth stays open, drops open. Then you have dry mouth, you have drool, different things like that. We talked about this in our session, Taylor. I'll share this with Paulina. Those people who have had their wisdom teeth removed, it lends to the jaw dropping forward, the weight of the cranium, and the tongue falling to the base of the mouth. So you want to try and teach your clients to keep their tongue pressed up to the palate of the mouth. So that's where the resting position of the tongue should be. And it's really interesting, because if you are working with your client and you say to them to press their tongue up to the palate of the mouth, you will see a tiny little bit or a lot of this, where they actually get more upright. So that's kind of an interesting thing, and you want to try and encourage them to do that. Rolling out the feet, always doing the foot and ankle mobility exercises. I check in, it's probably a regular question. Are you still rolling out your feet? Did you roll out your feet this morning? Did you remember to roll out your feet? I'm constantly asking about the feet, because that is something that's going to help them with their ambulation and gait, preserving the ambulation and gait. They've got to work the feet. Generally, we use the first part of the session to reinforce the daily routine, which is going to last about 20 minutes. These are the movements and exercises or stretches that the client's going to be doing daily. And then you can use the stage format sheets for a comprehensive guide. So you can use these. Maybe there's 2 or 3 exercises that you want to make sure that they learn, so they can do them as homework. So that's going to be the bulk of your session. Whatever it is that you want them to practice, you're going to do that in the class, right? And then you'll do like a few other things too. So generally, the beginning, breathing, spinal movements, head and neck, and then review of anything that they might have questions for you. So I'll say, do you have any questions, or did you understand the homework? Did you get a chance to do the homework? And a lot of times I have a client and they'll say, I was confused about where I was supposed to put my arm on this exercise. Okay, well, we'll review that. All right. So then I start the session, breathing, spinal movements, head and neck. And then I'll do the review of whatever it was. Let's take a look at that exercise that you were confused on. Let's do that again. So we'll go through that. Then I know that I want this client to work on extension. So I'll maybe give 3 exercises or 2 exercises with extension, with a lot of extra time on setting them up, how they get in and out of it, what are some modifications that they might need for their back, or because they have a sore neck, or because they have anterior head carriage, whatever it is. I don't need to discuss it with them, but I can just say to them, this might feel better for your neck if you do it like this, right? Okay, so that's like 20 minutes there. And then 10 minutes of it, approximately, we're going to be doing something for balance and gait pattern. That could be any of these things. It could even just be the foot and ankle series. It could be only that, where I have them stand at the counter, hands at the counter, and we peel up the heel on the right foot 4 times, 8 times, and then we do it on the left, and then we do both at the same time, and then we alternate, right? That could be the whole thing for the 10 minutes of contributing to improving their ambulation and gait. And then we can take a look at eye exercises. That's going to help improve their stability and balance. We already talked about that. And we always want to cue them to keep their eyes open. You'll notice once you start working with this population that everybody wants to close their eyes, right? Part of that is because of the kinesthetics, the visualization. It's also, remember, they've got extra neurosensory stimulation going, everything's amplified. Well, what happens when you close your eyes? You shut off one of the neurosensory inputs, right? The one that gives you the most stimulation, it's the eyes. So they'll close their eyes, and that will also help with them feeling where the movement is, but we need the eyes to be open. So you want to cue open eyes. Coordination patterns, quicker movements of arms or legs using focal targets that can be directional movement training, gamified. So on this one, you know, I'm going to have you turn to the right. Can you see the vase on the shelf? Yes. Okay. Go to the left. Can you see the clock on the shelf? Yes. Okay. Go to the right. What can you see beyond the vase? You know, oh, I see the picture. Okay, good. So you can point out things, or you can ask them, how far can they go? What can they see, right? And you can gamify that as well. Sometimes I'll stand behind them with my arms. How many fingers have I got? How many fingers have I got? You know, and then they'll have to say whatever the number is. Or you can, you know, think of fun ways. A lot of the coordination patterns that I do also with well, with all stages, but early to mid mostly, are the giant stability ball, bouncing it to them, they bounce it back. Now, when you bounce it to them, you are the moving person. They are the one who's staying in the middle. So I'll rush over to my right, bounce the ball to them. That means they will pivot to their right. So they're turning, and then they'll bounce it back to me. Then I'll rush over to the left and I'll bounce it to them. That means they have to pivot and turn again the left to receive it, right? So you're the one who's moving all around, and they just have to kind of make turns or such. And so that's a fun way to gamify and get a nice amount of spinal mobility out of them. Level transition training. This is changing levels, right? So the thing that you want to be conscious of when you're doing level transition training is orthostatic hypertension, because a lot of times the medications they're taking will cause that more than Parkinson's itself. And you both probably already know orthostatic hypertension is blood pressure issues where they get a little dizzy spell when they lift their head up or put their head down too fast, right? So the only thing I want to say when you're changing levels from one exercise to another, like maybe they did a standing set and now they're going to the floor to do a floor set, is to be close to them and make sure they have support getting up and down, and make sure they go slowly. Remind them to go slowly. All right. And if the person's able to get up and down to the floor, you'll find that out early on. If they can do it, you want to make sure you include something like that in every single session, because that is a skill, and that skill has to be preserved, right? If you don't practice that, and they don't get up and down to the floor, even though they used to be able to do it, they will lose it. And then it'll be harder and harder for them to move. So if you can get them up and down to the floor, do that. Besides the 20-minute routine that the client's going to practice, you know, that's the homework stuff that you're going to reinforce. You show it to them in your session for about 20 minutes, and then that's what their homework's going to be. You can also, well, you'll give them the homework, like, hold on one second, like the 1 or 2 special exercises that were done in the session. You are going to give them the homework that reinforces what they need. So it could be that, yep, you put your hand up, or that was an accident.
No, yes, I had that question about the homework.
Yeah.
Have you ever thought about giving them short videos, like if they have
Yeah,
for
yeah.
reference or
Yeah, we
something?
do that
That's
all the
okay.
time. So we talked to, this might have been mentioned in a session that you weren't in, but we do video clips all the time, which is
Okay.
why that video image release thing is really important for them to sign. Mostly
Okay.
it's for them anyhow, but just that you have permission to do that. So I do that a lot. I take pictures or I do video clips, and then before I leave, especially if they have an iPhone, I airdrop it to them. That is
Oh,
great.
yeah,
Yes.
that's perfect.
Yeah.
Perfect. Thank
That
you.
helps them a lot. All right. So let me just finish with this again. So let's say I did a lot of lateral flexion in my session. I'm going to give them homework, which is lateral flexion in the kitchen. But in addition, I want them to do lateral flexion of the neck. But let's say maybe I didn't do that in the 20-minute routine, but I know that's something that I also want them to do. So that extra exercise thing is going to reinforce what they really need, which is lateral flexion of the entire spine. So just because you don't do it in the 20-minute routine doesn't mean it can't be homework. You see what I'm saying? Yeah. Okay. And then finally, the red flags. Okay. So we are definitely checking in regularly throughout the workout session, asking them, how are they feeling? If they're in pain, are they dizzy? You need a break, you want some water. I just give them the water, after every 2 or 3 exercises. Okay, go ahead, let's take a break. Here's your water. Don't ask them, would you like some water? No, we don't ask, we give. Give them the water because they will never be thirsty. They will never want to take a drink. And by the time your session is done, they need to finish almost an entire bottle of water, at least 8 to 12 ounces of water. Okay, that's important. When you're and by the way, this is something I look for in the final project. If you're offering them water, how you're giving them breaks, how you're setting them up for taking a break. So when you're programming, you want to think of the priorities of the client. So if you're seeing heavy forward flexion, obviously the emphasis is going to be on extension throughout the programming. Music is optional. We talked about this in the neurocognitive approaches. Sometimes the music helps a lot. Sometimes it creates more confusion or stress or disruption, right? So the other thing too is the sound, how loud it is, what the tempo or the beat is. If it's a type of music that you love, but they really don't like, it's not going to help, right? Even if you think, oh, this is really nice, soft music. It's what they play in the spa. This is going to be great for them. That could not be the case, right? Okay, meds alert in general. These are things for you to know. If there's too much medication in the system, you might see them as glassy-eyed and even twitchy, right? If they have too little medication in their system, they might cramp more, they'll be more rigid, they might be unattentive, they might be zoned out, right? These are things just for you to know in case you're like, what's wrong with this, my client today, right? It could be nothing wrong with them except that their medication is whacked out. And this is the hard thing about Parkinson's disease. Because it's so different for every single person, the reality is the medications need to be customized for each person as well. But there's no way really to get precision medicine into that client, right? That correlates specifically to what they need. So usually the client has to go through a phase in the beginning of their Parkinson's disease of taking the medications, like a kind of almost a trial and error. Well, is this too much? Okay, well, let's break that tablet in half. Oh, now it's not enough. So now you need a half and a quarter, so they have to go through that until they find the magic amount that works for them. And just know that sometimes it's really a roller coaster ride. So your session, maybe you'll pull off 1 or 2 exercises in 15 minutes, and the rest of it is trying to help them stay seated or give them water or, fan them because they're having a hot flash, or listen to them because they want to tell you all about what happened at the doctor's office. It could be anything. You've got to be prepared, but just know that the medications can be a huge part of why you're getting a lot or very little productivity out of them. Watch for signs of dizziness and orthostatic hypertension when they're changing levels and body positions. Just remember to remind them to move slowly and carefully. We're in no rush. Take your time. Like I always say things like that, because you don't want them to get a dizzy spell and fall down. So it has happened to me, and it's very possible that they will be perfectly fine 1 minute, and then you turn around to get your notebook, and next thing you know, they're fainting or they've fainted, right? So no one's ever hit the ground on my watch, thank God. But you got to be attentive. So now, if I have to reach for something, I will position them first before I get whatever I need to get. That way, there's no risk of them falling down. And I've also had someone faint in my arms before because they were like, I don't know. This person has a Parkinson's plus disorder, so that's a whole other thing. But yeah, so just be attentive to that. Okay, now when you're giving them exercises and stuff, if they keep asking questions repeatedly about the exercise that you're trying to get them to do, it's probably too complex for them. So if you notice this happens 3 times, 2 to 3 times where they're confused or they keep asking again about something, then you either want to break it down so that you only give them one aspect of the movement and then you do the next one, or you may want to just change the exercise entirely, abort and give them something else, right? If the client's uncomfortable with an exercise, move on. And they may say, I'm confused. Oh, I don't, I'm worried about my back. My back hurts sometimes when I twist like that. Okay, that's all right. Let's reconfigure. Let's do something else. Just don't insist. Just find another way to implement the movement that you want. The other thing too is if you gain their trust in the movements you're giving them, they're more likely to do the movement that you really want them to do later. So in the beginning, let's say I'm trying to get rotation out of them, right? But they don't want to twist to their left because they're scared that might trigger a pain, right? So then maybe I'll start with something different, like let's just do the head and neck, and then maybe I'll give them the magic circle and I will hold the circle and I will walk a little to my left and a teensy bit to my right, and then by, 20 minutes into the session, now they're able to do this, right? So if the client's taking it slow or taking longer pauses or breaks between exercises, they might be reaching their energy limit or becoming physically or mentally tired. That's why we give breaks every 2 to 3 exercises and we have them drink water. And sometimes, they may be guarded on one side more than on the other. They could be in pain and they just don't want to see anything because they don't want to be, they don't want to cause a problem or they don't want to complain, or they're so used to being in pain that they just want to grit their teeth and get through it. And we don't want that. We want them to be as comfortable as possible. So it's our job to really be on the lookout. We're like hawks looking for something that's wrong. We're looking for any indication that this is not good for them, right? We want it to be good for them, and we're trying to make it as comfortable and good for them as possible. But we're attentive to any kind of change in facial expression, which probably won't be much because they tend to have the mask face, or any kind of like, if they turn and all of a sudden they do this kind of thing, that's a guarded signal, right? So anything like that. And I always assess the look in their eyes and how they respond to me, because that will tell me if they're on, if they're off. Is this a consistent session? Is this just, regular, or are they acting strangely in the sense of not the way they usually behave when we're in session? That's a clear cue that something's wrong. And by the same token, it could be that something's better. Like, for example, Taylor, you were mentioning how, I don't know if it was you, or no, it was Catherine talking about
Yeah.
how her client Max is talking more and telling
Yeah,
jokes. That's fabulous. Yeah, that's
I
a
know.
positive sign too. Yeah. So that's, that's the whole thing that I have for you on section 8. It's more just kind of like helpful tips, and then we get into the assessment thing. Okay.
Perfect.
And then we're going to talk about the final projects. So
Awesome.
right now, what I want to do is, well, one, if you have any questions about the stuff that we covered, I know I was talking a lot and throwing a lot of stuff in there. And then we'll take a little break, and then I'll go into final projects. So do you or Paulina, I don't know if she's there or she left for a minute, but if you have any questions about what we just covered?
Not right now. I don't, if anything comes up, I'll,
Yeah. You can always let me know. Paulina, did
yeah.
you have any questions about anything? I know I just threw a ton at you. Oh, and
No,
by the way,
I'm good.
the ABCs, accuracy, balance, and coordination. I'm sorry, I kept thinking
Okay.
attentive, and there were so many A words in my head, and I knew if I just left it alone, it was going to pop back in. So it's accuracy. So thinking about that's the
Seriously.
cerebellum, what it's responsible, A, B, and C, accuracy, balance, coordination. So accuracy equivocates or equates to neural sharpening. Okay. All right. Okay. Let's see, but let me see what time it is now. It's 7:14. Can we just take 5 minutes and then we'll get back on? We'll talk about the final projects, and then we'll be done a little early tonight. This section was a little shorter. Yeah.
Okay.
Okay. All right.
Yes.
So 7:14. Let's say 7:20, so 6 minutes. Okay. All righty. Great. I'm going to pause this. Okay, cool. So let's talk about final project. Okay. All right. So as your final project, well, let me preface the final project by saying this. For me, it's really important that you instructors understand how to really work with your clients, not just kind of regurgitate exercises to them and stuff. But I really want you to be able to look at someone and to understand not only what's going on with them based on what you see and listening to them, but to know what's going on based on your new knowledge of Parkinson's disease, right? And what they're going through. So the only way for me to really know is to watch you in action, right? So this is why the final projects, it's not a test, it's I want to see how you do it. And there is no pass or fail. There's only you did it, and it can be better, or it can be fabulous, or it was better, it was fabulous, whatever it is. I just want to see that you can help this population and be effective, right? Okay. So your task is going to be to find a Parkinson's client, or you may already have somebody that you're working with, and you're going to need to do the intake forms. So the initial one, the client assessment intake, and then the one that you would give them, the preserve your movement independence form, which is their kind of like giveaway, you're giving them one exercise of each. Take all their information in, and do your global postural assessment. And then you're going to put them through an exercise series. So it's going to be 25 to 30 minutes is how long it's going to be. But in reality, I think every single person who's done it so far has taken almost up to an hour, because, you just start working with the client and then you take them through a bunch of stuff and whatever. So it can be as little as 25 to 30 minutes. It can't be less than that. Okay. You're going to figure out what the outstanding points are that are positive about the client and the need support points. So when I say the outstanding points that are positive, it could be that you get a client and you're like, okay, this client has a really strong upper body, or this client has a strong core, or this client is so positive, or these are outstanding positive things that you can really take advantage of and work with. The need support, maybe the client's very depressed all the time, or the client has a serious drop on one side from spinal asymmetry, or the things that need work, the right ankle is twisted externally, and so they're always walking like that and complain that their knee hurts. You know, whatever it is, you got to find a black and a white so that you can determine what the gray zone's going to be, what the instructor is going to focus on for the session and why. So when you schedule your session with me, you'll find the client, you'll set an appointment time with me. I will come on and you will introduce your client and you will tell just a little bit about the client. If the client wants to say anything or say hi or talk or whatever, that's fine. And you're going to either say or just let me know by sending me in advance if you want one of those program sheets, the session format sheets, so I know what you're going to focus on. Now, it could be that you send me a sheet and says, we're going to focus on this. And then on the day of the session, when the client comes to you, you have to throw that out the window and do something entirely different because whatever reason, right? That's okay. Taking your SOAP notes. So during your session, you want to kind of already have an idea as you're doing something, what the possible progressions and regressions could be of the work that you're doing with the client, because they have to replicate it at home. So you already have to be thinking of for the client. So if you start with your neck like this, and then maybe you can bring your arm up and you can come into this. So this would be a progression, an idea of where the client's going with this movement that you're starting with, right? What's the goal of the client and what's your goal for them? So I always ask my clients, so what do you want? What do you want to get out of working together? Or what do you want from these sessions? You know, they may not care about anything about lateral flexion and extension and better posture. I've had people say to me, I just want to be able to go back to the gym. I love weight training. I just want to be able to weight train. Okay, I'll write that down. Then in my mind, I'm like, what do they do at weight training? What, you know, how can I get him into a better situation to do a squat? Well, squats, lunges, those are all gym things. So, you know, kind of get information out of the client. What's my goal for them? So my client says, well, I just want to be able to go back to the gym again. But what I see is the client is not very stable. So my goal for them is to get them stable enough to stand independently without falling over, right? So more stability in their stand. And what do I see that needs immediate attention? Postural stability needs immediate attention, right? What stage are they in? You're going to need to tell me what stage. You won't have to say it in front of the client, but you can have that written down, and you don't have to use a number. You can say early, mid, late. Odds are you're never going to say late. You're going to say early or mid. But it's even better if you don't discuss stage in front of the client. That'll be more stuff that you would talk to me or your colleagues about. Why did you decide that they were in that stage? And where do you see the in to begin your work? So when I say the in, it's stuff like this. Early stage client used to be a ballerina dancer. Ballerina dancer. Okay, that means all the foot and ankle stuff, that's going to be something that I'm going to latch on to. I'm going to do it parallel. I'm going to do it Pilates V. I'm going to do it, you know, all these different ways. That's an in. Okay. Or like I was talking about earlier, my other client was a philosophy professor. That's an in because he's articulate, he's a writer. I'm going to pair a lot of philosophy, neurocognitive things with him, right? That's an in. So you got to start thinking in terms of where your ins are with that client. What kind of cueing techniques are you going to include and why? Again, you don't need to discuss it with the client. You can just let me know, but I will already know when I watch the client and listen to the client, and when I watch and listen to you, I'll probably already know what you're doing. And what are the client's red flags, and what are you going to do about that? So again, I'll be watching, I'll be able to see what red flags are. You will see what you see or hear what you hear, and you'll need to communicate that to me of these are the red flags that I'm looking at, and these are the ways that I'm going to address it. So it's a PD case scenario. This one, you're not going to break into pairs. You're doing it by yourself. And the way that it's going to work after you make your appointment, go through the session with the client, then you have a second appointment with me, which is the breakdown. So that's where we'll take like 30 minutes together. I will film the session anyhow. So, and I'm taking notes the whole time. I don't talk at all. I just sit there quietly. Probably in the session, I won't even have my face on. It'll just be my icon or the logo, whatever. And then at the end, I'll come back on and thank you. That was great. And I might give a teeny bit of feedback, but really none, mostly for the client. Thank the client. How do you feel, client? Maybe the client wants to say a couple things, that kind of thing. And then when we get together, that's when I'm going to say, all right, so you started with this, and I'll show the video. And then here, maybe we could add that, or could you consider this? Or, so I'll help you so you can refine your teaching and amplify your perspective about how you can work with people who have Parkinson's. And that's pretty much it. Let's see. Yep, that's it. Questions? Do either one of you already have clients?
I have one client and I have another one that I haven't asked if he would be willing to, but he also might. So I have one for sure though.
Okay.
And I think you've already met.
Oh, Max, I mean,
Mike?
Mike, yeah.
Yeah.
Okay. Yeah, I mean, if he's willing to do it again, it's better if you can find a different one.
I
But
have
if
one
you
in
can't-
mind but I don't know how he'll feel about it. So I'll
Sure.
talk to him this week or weekend and see if
Yeah.
he'll do it.
Okay, that's nice. Okay, and what about you, Paulina?
Yeah, I have my dad. My dad is my
Oh,
client.
that's right. Yes, yes, yes. I'm
Yeah.
sorry. Yeah. Is your dad on board? Have you been doing any
Yeah.
stuff with him?
Yeah, everything. It's been really, it was a great idea taking the course this way because I've been applying all of that I've learned. And since my dad is in stage one, yeah, he's like really strong. But I think it's interesting because the changes are very subtle, and I can start correcting them from the little things, because before I only look at the whole spectrum. I don't know if
Mm-hmm.
I'm making
Mm-hmm.
myself. But right now I can look at the little things that I've never seen before. Like he also started questioning himself. And that was like for me to take to look at him more mindful about his
Yes.
body.
Oh, that's fabulous.
No, because he's so mindless. He's still working. He's like super functional, but he has this stages on during the day where the dopamine is
Yeah,
wearing
he
off
dips
of the
and
meds. So it's like a crash, but
Mhm.
it's so impressive because he's a huge man. Like he's really tall, he's like really strong, but you can look at him like starting to slow down until I can some people don't believe me, like my dad, he looks so strong and he's so functional, but there are hours in the day when he cannot move. He's like taking 1 minute to turn right, you know, and those things, they can he can find a connection through mindfulness.
Oh, good.
So when I'm always like, remember what are we doing right now? Like we're doing this. So I'm always trying to get him back to the today, because he's always thinking about work. For him, he doesn't have anything until
Yeah.
he's slowing down. Then he remembers he has this disease now.
Yeah, the
So it's
breathing will help a lot. Yeah.
Yeah.
Also, I want to let you know now, because he's in stage 1 and you keep saying he's a tall man. Is he 6 foot or
Yeah.
taller?
I don't know in feet.
How
I
many
know
centimeters is that?
I think he's about 180
You
something.
want to somebody want to Google centimeters, and I look
Yeah.
that up and I'll tell you why.
So
You're
it's about
It's like 5'10".
5'10", yeah.
My height.
Okay, you're
Oh,
5'10".
I'm like 180.
Wow.
no, maybe he's taller. I don't know, but he's really tall. So maybe I don't know. I'm like the worst with numbers, but he's
Okay,
a big man.
How tall are you? Do you know?
I'm yeah. Let me. I am 5'6".
Okay, so he's probably 6 foot.
Yeah,
Okay, when you have a man that's very, very tall, especially him because he's in stage 1 now, you want to really strengthen his back extensors.
Totally.
Because
I'm
the
working on it.
taller they are, the more they crouch
Yeah.
down. Yeah.
Yeah,
So,
totally.
one of the-
I gave him the spine corrector, the arc, the one that you can break into. And I'm always like, go like and lay down right there. And he started to doing circles by himself. And I also encourage him to notice what his body is doing. Like
Yeah.
if you're going forward, use your logic and if I'm not around, what would you do? What's the logical thing to do? So he's starting to assess himself more, you know,
Yeah.
and that has
that's
been like
really
really helpful.
important, that self-awareness.
Yeah.
But for you to remember that a lot of times they could be down here and think that they're perfectly upright. So you
Yeah.
can't assume that they are purposefully like falling
Mm-hmm.
into flexion.
Yeah.
Another thing you can do is the doorways. We call it the monkey hang. It's an exercise we do for the tall guys. They stand with their back in the door frame, and each hand hooks onto the door frame, one side of each, back against the wall, right? And to stay
Yeah.
there because they can reach, and to march one leg at a time. Yeah, that's
Okay.
a really good one, to help them stay upright. Gaze is forward, and the head is,
Yeah.
and the back, everything's against the frame of the door. So they're
Mm-hmm.
standing in the middle of the frame, like half of them is on the right
Sorry.
side and half of them is on the left side, if that makes sense. Bless you.
Yes, he's been loving, thank you. He's been
Awesome.
loving those exercises. Also, we've been working on rolling on the floor.
Oh, nice.
So I put together like 4 mats together,
Uh-huh.
and because he started having problems to getting up from bed.
Mm.
So I told him, if you have your hands over here, you cannot roll over. So try to put your hand. So I just gave him like one instructor one time. And I told him, use your feet, always use your feet. You gotta move your whole body together. So I keep him rolling up over and over and over again, and he's loving it, because then by the 5th time, he started like going a little bit more,
It's easier.
more quickly, and it's easier, yeah. And
So
also it's
you
easier to
can-
get up from the floor. after that.
What you
Yeah.
want to do also is start on your back, roll over to the tummy, push up, go down,
Oh, yeah.
roll back, push up, go down.
Yes, yes,
So
yes.
that will start really helping him with extension and upper body
Mhm.
strength to get himself up out of the bed. Yeah.
Yeah,
There's
that's
so
a great
much.
idea.
I mean, you guys,
Yeah,
you would
Yeah.
not believe how what a game changer it is for someone who has Parkinson's disease to be working with one of us. You know,
Yeah.
I even got another call from a client who said that the neurologist, she was just at the neurologist, and the neurologist was just complimenting me and throwing all these roses on me about my work and stuff. And she's only doing that because the patients that she has that see me are completely different in terms of their movement than the people who don't. So we can affect a huge change. So I'm really excited to see you all with your projects. Okay, so final project wise, find your client, do the paperwork, and hit me up for what potential days or times could work. Okay, I know that mostly people of Parkinson's disease are better between the hours of 11 and 4. So just let me know when you need to do it, and we'll go from there. So we'll set that appointment up, and then we'll set the follow-up appointment up. Can be then or after, it doesn't matter. And Paulina, I
Okay.
also want to tell you, Tere Lopez is coming on Sunday to do her master trainer program with me. And then at the end of
Interesting.
March, we're going back to PV, and she's doing the live course there. It's going to be in Spanish. And if you would like to come and go through the course live, you're more than welcome to, because I know that you missed a lot of the
Yeah.
you know, the live sessions here, if you're able.
Yeah, that was a great idea. I'm looking for it. Because it's like Semana Santa, you know, so it's gonna
Oh,
be like super crowded, and
in
it's
March?
the just right on the weekend. Yeah, it's Holy Week, starting the 24th.
The 24th?
So it's gonna be like
Oh,
super
Palm
saturated with
Sunday's the
tourists. Yeah.
24th. Okay, so
So
what?
it begins since Friday. People start vacationing from there.
Oh, well, I'm
Sometimes,
wondering,
yeah.
she's gonna come on Sunday, so we'll talk about it. I don't know, maybe she wants to put it the week before. I'm not sure.
Yeah, so it's
You've
not
been
too
promoted,
in the airplane tickets and everything is gonna be
gonna
like
be
super
high.
high.
Are you
Yeah,
far away from there?
I am. Yeah,
Oh,
I gotta take 2 planes there.
oh my
I've been there
God.
because I got certified with her.
Yeah.
And I went like once a month for my certification, and I haven't, and that's it, because it's like messy to get in. I have
Trust
to
me,
buy
I get it.
car or something, yeah.
Yeah, I totally understand. I had
But
to.
I would love to go. I miss those studios
Yeah,
days.
I mean, if you
Yeah.
can, if we can make that work out, I'll talk to her more in depth if it's the Holy Week, and I don't know if we need to change it or what. And Taylor, of course, you're more than welcome to come to the course as well.
I
And
know. I
anybody
mean,
who
yo hablo un
comes to the
poquito
course,
español, so
yes, there you go.
That's perfect.
Yeah.
Yes.
So, all right, ladies. Well, thank you so much. If you have
Thank
any
you
other
so
questions, hit
much.
me up.
Thank you so much,
And I'm so
Cecilia.
excited to set the
Too.
appointments and to see the projects. Okay. All right.
Thank
Ta-ta.
you. Bye.
Bye.